Hey everyone, this is David from Aesthetic Solutions, and today we're going to get into the body sequence and proper technique for the Synergie AMS treatment. We have the newest elite system. We have the microdermabrasion system, which is digital. We have a little shell for light therapy if you choose to have something like that on the device. And of course the body system itself. The footprint is smaller, so it can fit in smaller rooms, easier to maneuver, and the mast system moves, where on the classic original system it's static and won't move at all. So trying to make it a little bit easier to use. With the techniques, there are 4. The key word here is technique. It is critical you do these in the correct sequence and the correct way. I cannot emphasize that enough. So first and foremost is the whirl system. And what we're going to do is we're going to do clockwise concentric circles, and I'm going to show you that here on our model here. So what I want you to do, which is a little bit different than what you may have been taught, is I want you to work on the left side of the skin tissue, the middle, and the right. By us doing that, we cover in a very uniform manner the whole body part, as opposed to just working around. So here's how the whirl looks. We're going to use our right hand, or whatever hand we're going to use on the handpiece itself should be on the handle. It shouldn't be here. You affect how your technique and the maneuverability of the handpiece is. So with this hand, whether it's the left or right, you're going to push. With the opposite hand, you're going to move it around. So here's what it looks like slowly. Again, left, I'm pushing and then turning with my other hand. Push, turn, push, turn, push, turn. I stay within my body part. Come to the middle, same thing. Push, turn, push, turn. The right speed, here's what it looks like. We're going to do each move for 45 seconds. The total treatment time we prefer, you can do a 30 or a 40 minutes, but we recommend the 40. Okay, that is the whirl. Second is the bounce pull, and this is really the magic, the key move as it comes to this Synergie AMS treatment for the body. The key, and really, the main thing about it is that it's going to stretch connective tissue, and it's going to move toxin and impurity out of the skin. It's going to be able to escape into that interstitial fluid around the cell and be moved out of the body through the immune system. This one you really have to get right. So, right here we go with the treatment itself. Hence the word bounce. We're going to bounce it or push down almost like a kneading effect onto the skin. And when we get to the top, again, stay within the body part itself. I don't want to go into a buttocks or somewhere else. This is where most of what we see that is incorrect happens. Most treating come to the body part and then they immediately come back down, all right? That's incorrect. What you want to do is bounce, bounce, bounce. At the top, stop. Just for a split second or even less than a second, and then pull straight up so you have that connective tissue, and then you can pull down. That's what's going to create the effect. That's going to create the skin tightening and a lessening of the cellulite for that client. So again, bounce, bounce, bounce. At the top, stop. Come straight up and then down. Bounce, 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 bounce. Stop, straight up. You see what I did? I came up there. I did that on purpose because I want you to push it. I don't mind you bouncing off a little bit because I want to stretch that connective tissue as much as I possibly can, as opposed to someone who's being a little bit conservative and you're here. Again, this is the main move, so really practice it and get it correct. Third is going to be the wave, and the wave is rounded in technique. The key is not to move the back of the handpiece. When you do this on the body, you're not in line with lymph vessels feeding into the heart. We want to push everything towards the heart. So if you're doing this, it's off. The key to doing this properly is taking your hand from here and moving it closer so that you don't do this. Here's what it looks like. Same technique, left, middle, right. I'm going to, again, create that rounded effect while not doing this. So I go left, middle, right, and again, just back and forth. Each move is 45 seconds. But again, the key here is rounded. It's not this, it's rounded. Okay? And last but not least is going to be probably everyone's favorite, probably the easiest one is the glide. Because all you're really gonna do is just push the handpiece away and bring it back to you. So just like everything else, we're gonna start in that lower left and we're gonna push it away and bring it to us. Away and to. What I wanna see is a little bit of pinkening of the skin, which I can kind of see through the handpiece on the skin. If you come in, you can actually see a little bit of pink on the skin, and that's kind of the effect we want to have, which is why the suit is very sheer and light. So again, that's the 4. There is one other piece. Can I have that handpiece over there? Right? Those are the 4 main moves. There is one additional piece. Of course, I have 3. You want to make sure that the handpiece fits the body parts, right? We always start with the calf. I showed you the thigh because it's a little bit easier to work on, right? But your sequence is going to start with, again, the calf. The patient or the client's not going to feel a lot here because the calf is a very dense muscle. Same thing. Now she, if you notice, is pretty thin in the calf area. So again, I want the body part to fit. So I'm going to move to my smaller piece. And really all I'm doing here is the whirl. I can't do a lot of bounce pull in the other technique. This is one of the openings to the lymphatic system, so I want to start working my way with it. So we start here. Again, we're going to come up into the thigh. And again, your sequence is calf, calf, thigh, thigh, left side of the buttocks, right side. With the back, right? One of the key questions that we like everyone to use is there any one area you're most concerned with? If someone says, you're going to hear a lot of stomach, you're going to hear sometimes someone's going to say back here, they use the term bra fat, right? And it's okay. We want to focus on that and really give them, a really great treatment as it relates to that. So we're going to come through, we're going to move, again, calf, back to the thigh, buttocks, right? Because of the video, all right, our model here has underwear on, and they are pretty sheer, right? But you may want to have someone wear a thong, or again, at the very least, something very sheer. Something that's thick will affect the adhesion of the treatment when it comes to, the handpiece coming over the skin. Same thing for the bra. We actually recommend they don't wear the bra because as we come up, I can kind of hit pieces of it and it comes off a little bit, right? And can affect the treatments. So if the client is comfortable, we would like them to not have those. This is a private treatment, of course, so they should feel somewhat comfortable. If not, perhaps you can use a towel in those areas to make that client who may be a little bit more modest comfortable. So, same thing here, left side, right side. So I'm going to come in, this does fit here. You are going to have a lot of folks that are bigger in the thigh, so I'm going to have to use the piece that fits the body part. Don't use one for all. Make the handpiece fit the body part. That's the key. So, with her, again, this one is going to be pretty good fit for the buttocks area. Same thing we've been talking about. Left side, right, and middle, right? So the key with the buttocks is, as opposed to the thigh, you have some bend. You have to compensate for that. Whereas the thigh is very straight, it's very easy. So for instance, if I'm doing the bounce pull, at the top, I come here. Now when I come down, I have to kind of come down a little bit. So I have to balance this so it doesn't come off. You don't want this. You want adhesion. So now I come here, the middle. You see what I'm doing? As I come up, I move this hand piece up. If I don't, I'm gonna come off. Same thing coming down. If I don't move it down, I come off. So you just have to kind of adjust it to the angle. So again, bounce, 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 stop, pull, come here. Now I have to kind of come down and move the angle down. The back. Someone like her, she doesn't really have an issue here. So really all we're gonna do, she's pretty tiny in the waist area, but that doesn't really matter, right? If you have someone, right, that you're treating, I don't care if they're a swimsuit model, they want to be as tight and slim around the waist as possible. So this would be my move for her. We're gonna come in and I'm gonna do just a little bit of a whirl, focusing on the sides and lower back only. She's thin. If I come in here, I can literally feel her ribs. I will hurt her. I will rake this over that and that'll hurt her. I don't want that. So I'm gonna do, again, some side to side whirl. Notice again, I'm straight, everything going towards the heart, and then I'm gonna do glide in this area. Don't come up here, stay here. If she had a lot of loose skin here, I would do the same 4 moves that I've been talking about. Number 1, of course, the whirl, bounce, pull, the wave, and the glide, okay? 2 more things here, and then we're gonna go to the side, right? We have a move called the scoop. And what the scoop is gonna do is, it's gonna create more definition in that gluteal cleft, and it's gonna create lifting. So, right, let's talk about levels, right? When you're on the machine, typically your levels, you're not gonna go up above a 6 because it's too much. You don't wanna go too high. Less is more. You don't wanna have someone on an 8 or a 9. With this one, they will bruise. So 6 is the highest you wanna go. We have higher levels up to 10 because we have microderm and we may have a tanner and be able to utilize that extra energy with a device. So, that said, I just told you don't go above a 6. The exception is when we're doing the scoop in the buttocks area. It is much smaller as opposed to the larger, so it's not a problem to be at an 8. And that's where I want this to be on an 8. And all we're gonna do, I'm gonna use 2 hands. I'm gonna come up, and this edge is gonna be into that line. Notice that most women don't have the line over here or over here. It just usually comes in here. I only wanna be in the line. So I'm gonna come up, and I'm gonna scoop. And again, I'm gonna create that definition and lift that someone is looking for. We can do that on the buttocks if that's a key area where we can scoop to give that person a little extra, and it does a really great job. Last but not least, when the client is on their stomach, is their arms. So I'm gonna have them lay their arms over on the side, and same thing here. Let me just move my machine a little bit. Pretty easy to move. She's pretty thin here. So same thing, I can just do the whirl on her. If someone is a little bit bigger, you can do some whirl and glide side to side. Notice again, what am I doing? I'm pushing towards the heart. So, same thing, left side, middle, right. And that's really all we're gonna do for 45 seconds. We'll do this side and we're done with the back, okay? So let me take these off. Can I give you that? Thank you, ma'am. Just the big one. All right, so now what I'm gonna do is, I'm gonna have her keep her head this way, but come to the side. Keep your head to the left, okay, but come this way, right? The lower leg leg is always straight. Straight, okay? This leg, straight, this one's gonna be at a 90-degree angle. And what I'm looking to do here, right, is, right, this under here, it's fine. I'm looking to treat the inside of this leg and the outside of this, okay? So I would want her to have that mirror. She's not very flexible, all right? So that's the 90-degree angle I'm looking for, right? So I'm gonna treat the outside of one leg and the inside of this. So as an example, if someone, when I'm talking to them and I say, is there any one area you're most concerned with? And they say, really the inner thigh, I kind of rub a little bit and I don't want to. I need to be able to get here. Now, of course, everyone, has different shape or size. We recommend one of the pieces for, like massage therapists use the roll. The Naugahyde, harder one is better, because now what I can do is I can put it under the leg and I can lift it for me to be able to get into that piece there, okay? Same moves we've been doing. I will do the inner, outer, I will switch her, right, and do the outer and inner of this leg, right? And then that's perfect, we're done. Then I would have her, right, towards the end of the treatment, be on her back. So go ahead and move on your back, please, ma'am. And my sequence here is to be on the quads. And what we're going to do is the same thing we've been doing. Left, middle, right. Again, whirl, bounce, pull, stop, come up and down, wave, which again is that curve, and then lastly, the glide, which is pushing away to you and to you. All right? Last but not least is the finale. It is a critical piece as it relates to this treatment. If you do everything right but don't do the finale, you're not moving everything that we've moved to the drains of the body. You have the inguinal near the belly button. You have a small little valve or drainage under the solar plexus. And then you have the axillary that runs from the clavicle to the axilla. So what we're gonna do, and the key to this, the absolute key is feather light. Why? Because we're focusing on the lymphatic system. And the reason Synergie works is because we have movement in the venous, your blood system, and the lymphatic system together. Again, Synergy is the word. You can move the venous system, go walk, run, do anything like that. Lymph is the key, and it does not move easily. In fact, muscle contraction is really the only thing that's going to create movement in it. So it's very important that we do this the right way. And the correct way is to have a feather-light approach to our lymphatic drainage. So we're going to focus, right, in this area. I'm going to turn the machine down. And again, light pressure and light pressure of the hand. If I push too hard, I'm actually pushing through the capillary wall and I'm not going to get movement. So here's how I want you to think of this. The firemen go out and they use their hose for a fire. They come back and they drain the hose, and most of the water has come out of the hose. However, there is some residual water inside it. If they want to knead it or move it out, they wouldn't press hard. They would lightly just create movement and a little bit of pressure to move it out. That's how I want you to think about doing this treatment. I don't want to push hard. I want to be really light. So here we go, right? Most of what we're going to focus on is the leg because it's a very large body part, okay? We're going to come in and we're going to be very light. We're going to do the top side, the middle, and the bottom. So I'm very light. You can see her hip bone. And I'm going to drain right there or deposit there. Now I'm going to come to the middle. Same thing. See how my hand piece is pointing towards the heart? That's the middle, and then the bottom. Now what I'm going to do is, again, very lightly, Her solar plexus is here. I'm going to lightly have adhesion and push 1, 2, 3 for any of that residual overflow. Next, I'm going to work on the leg, and I'm going to come at the bottom of the thigh, mid, and upper. So I'm going to come across. As soon as I get here, I'm going to be on that top line, again, straight. Here, deposit, mid-thigh. Get to the middle line, deposit, upper thigh, come to that lower line, come across, deposit, same thing. 1, 2, 3. Okay? Now, do this please, ma'am. Right? Last is I'm going to come up into the axillary. Just like when I started, I'm going to get the top line, middle, and bottom. So I'm going to come all the way up, and I'm going to drain. See how she came off a little bit because of the bra? Right? I'm going to deposit there into the axillary. So that was the top line. Here's my middle line. I have good adhesion. I lose a little here. I lose a lot more here because of the bra. Deposit. And then last is that bottom line there, deposit. The very last thing I'm going to do is I'm going to focus on the arm. Just like we've been doing, left, middle, right, towards the heart. That's one side. We will follow with the second side. Some of you may be saying, I didn't really spend a lot of time on the stomach. You will spend a lot of time on the stomach, and you will do the same 4 techniques. What is important is how wide that person is. So you may need to, again, make the correct moves, the correct sequence, but most importantly, the handpiece has to fit the body part. So someone may be a little bit wider, you may need to use the largest handpiece, right? She again is a little smaller, so I could do pretty well here, but the same technique is involved. Okay? So that concludes this. If you have questions, if you'd like to talk to us, please, you can reach out to us. We are Aesthetic Solutions. Our tagline is beautifulsuccess.com. Reach out to us. I'm David at beautifulsuccess.com. Call us, email, and we'd love to help you out. Thank you so much. Have a great day.